In today's video, we will look at the classification of wounds. So what is a wound? A wound is a disruption of the normal structure and function of the skin and soft tissue architecture. So a wound is a break in the disruption and normal integrity of the skin and underlying tissues. Wound can be caused by physical, chemical, and biological factors. So wound is an loss of integrity of the skin and underlying tissues, and it can be caused by physical, chemical and biological factors. And one of the important aspect of wound is that it initiates a healing response. Wound initiates a healing response. Okay, next coming to the wound definitions and classifications. Wound can be broadly classified as acute versus chronic. So what is an acute wound? Acute wounds occur suddenly and often there is an identifiable mechanism of injury. So acute wounds occur suddenly and often there is an identifiable mechanism of injury, whereas a chronic wound does not heal within 30 days. So what you see in this picture is a chronic wound, and this chronic wound has not healed for many days. Okay. Next is surgical versus non-surgical wound. So what is a surgical wound? Surgical wounds are controlled form of wound, and surgical wounds are created intentionally in the operation theater. For example, surgical incisions, surgical drain site, etc. So here in this picture, you can see a surgical incision sutured with the staples. So the next one is the classification of surgical wounds. The surgical wounds can be classified as class 1 clean, class 2 clean contaminated, class 3 contaminated, and class 4 dirty infected. So what is a clean wound? A clean wound is an uninfected operative wound. An uninfected operative wound in which there are no signs of inflammation, and the surgeon does not enter the respiratory, alimentary, genital or urinary tract. And in addition, clean wounds are primarily closed and if necessary drained with a closed drainage. So what are some of the examples of clean wounds? Mastectomy, thyroidectomy, herniorrhaphy. What is that? That is the repair of hernia. Herniorrhaphy, and splenectomy, that is the removal of spleen. So these are all examples of clean wounds. Now what are the characteristics of clean wounds? How do they look like? Clean wounds have a smooth surgical incision. No redness or swelling, that is no signs of inflammation, no redness, swelling or discharge, and closed with sutures or staples, and it will have a sterile dressing. So these are the visual characteristics of clean wound. So the next one is class 2 clean contaminated wound. The clean contaminated wound is again an operative wound in which the respiratory, alimentary, genital or urinary tracts are entered under controlled conditions and without any unusual contamination. So specifically surgeries involving the biliary tract, appendix, vagina or oropharynx are included in this category. So what are some of the examples? Cholecystectomy, cholecystectomy, bowel resection without spillage, pancreatectomy, pancreatectomy, cesarean section, nephrectomy, that is the removal of the kidneys, nephrectomy, liver or renal transplant, liver or renal transplant, and creation of ostomies. Creation of ostomies. So these are coming under clean contaminated wounds, class 2 clean contaminated wounds. So how do they look like? What is their visual characteristics? There will be a surgical incision with the sutures or staples in place. No signs of infection. No signs of infection like no pus, excessive redness or swelling. May be located in abdomen or pelvis and often covered with a sterile dressing. So they have surgical incision with the sutures or staples, no signs of infection, and may be located in abdomen or pelvis, and they are often covered with a sterile dressing. Now coming to class 3 contaminated. So they are actually open, fresh, accidental wounds or trauma wounds. Open, fresh, accidental wounds or trauma wounds. In addition, there can be major breaks in the sterile technique. For example, an open cardiac massage. The surgeon may do an open cardiac massage, or there can be gross spillage from the gastrointestinal tract and incisions in which acute non-purulent inflammations are encountered are included in this category. So what are some of the examples? Some of the examples are bowel resection with the spillage and gunshot wound to the abdomen, open cardiac massage, appendectomy, use of unsterile instruments and surgery for open traumatic fractures. So these are some of the examples of contaminated wounds. Now what are the visual characteristics? There will often be a fresh surgical or traumatic wound and may show signs of inflammation, but there is no pus. And there may be often involvement of exposed tissue. Exposure of tissue may be there, or maybe exposure of GI contents. So these are the visual characteristics of contaminated wounds. Now coming to class 4, dirty infected wounds. They are actually old traumatic wounds with some devitalized tissue. And there may be already there may be some kind of clinical infection. And even there can be organisms. There can be organisms which can cause postoperative infection later on. So dirty infected wounds are all traumatic wounds with retained devitalized tissue, and there may even be clinical infection or perforated viscera, and there can even be organisms causing postoperative infection. So what are some of the examples? Examples are abscess, incision and drainage. Then perforated bowel. Then wound debridement. And there may be gangrenous tissue. Gangrenous tissue. These are all examples of class 4 dirty infected wounds. So what are some of the visual characteristics? Presence of pus. There will be presence of pus or necrotic tissue. There can be foul smelling discharge, then swelling, redness and heat, and there can be irregular wound edges. So the visual characteristics of dirty infected wound include there may be presence of pus or necrotic tissue, foul smelling discharge or signs of inflammation and infection, and irregular wound edges. Okay, coming to non-surgical wounds. Non-surgical wounds can be caused by blunt or penetrating mechanism. So different mechanisms are involved like physical, thermal or electrical or chemical injuries. Because of this, the wound size, shape, depths and locations may widely vary. And because of that, each individual wound should be evaluated, managed and cared in a different manner. Now coming to superficial versus deep wounds. Superficial wounds do not penetrate beyond the dermis. Superficial wounds do not penetrate beyond the dermis, whereas deep wounds will involve subcutaneous tissue and may involve the muscle and the bone. Okay, so in this picture you can see that this is epidermis, this is dermis and this is subcutaneous tissue. So the superficial wounds do not penetrate beyond the dermis and the deep wounds involve the subcutaneous tissues and may involve the muscle and the bone. So in this video we have seen what is a wound, the major classification of acute and chronic wounds, and then the surgical classification of acute wounds, what is a non-surgical wound and the difference between superficial versus deep wounds. So thank you for watching. Please like and subscribe.